Hi there, it's Dr. Dora. And before we dive in today, I want to ask you for a quick favor that makes a huge difference to me. If you're enjoying these conversations, learning something new, or even just feeling a little more seen after each episode, would you take a second right now to hit subscribe or follow on this podcast? It's one small tap for you, but it's a giant leap for this mission of healing, truth-telling, and breaking generational silence. Subscribing means you won't miss a thing, and it tells the platforms this show matters, that your voice and stories like yours matter. So go ahead, pause me for a second, and hit that subscribe button. I'll be right here when you get back. Thank you. Hello, and welcome to Ask Dr. Dora. I'm Dr. Dora Dixie, board certified in family medicine and addiction medicine. Ask Dr. Dora podcast is my virtual medical ministry that will be used to share knowledge about things that matter and hopefully ideas for living a healthier life in all areas, be it physical health, mental soundness, or spiritual peace. My dream is that this ministry helps somebody, somewhere, somehow, with something. Knowledge is power. The more knowledge we have about the magnificent bodies we live in and how we function physically, mentally, and spiritually, the better care we can give it for improved and hopefully the best possible health. Today's topic is prenatal drug use. My information is from the National Institute of Health, SAMHSA, and the National Survey on Drug Use and Health. Alcohol and other drugs, if used when a woman is pregnant, is a leading cause of babies being born with brain and nervous system problems in the United States. It is estimated that in the United States, about 5% of women reportedly use at least one addictive drug during pregnancy, and that includes cigarettes. Let me break it down. In 2020, almost 3% of pregnant women in the United States reported using marijuana daily or almost daily. Common illegal drugs that pregnant women may use includes all drugs and also over-the-counter medications. In the news and on TV, women who use drugs are often shown as women of color. But in a study from the NIH found that most women who use drugs are actually non-Hispanic white, about 68%. They don't go to college and they make less than $20,000 a year. This study also said that pregnant women who use drugs often have money problems and struggle with their mental health. It said these women need special help and checkups for their mental health and drug use before and during pregnancy. Problems with the pregnancy includes prenatal labor, and the definition of that is regular contractions result in the opening of the cervix after 20 weeks and before 37 weeks of pregnancy. 11.6% with marijuana and 24.3% with cocaine, compared to only 6.7% of women who don't use drugs during pregnancy. Stillbirth is defined as death of a fetus after 20 weeks of pregnancy, according to the World Health Organization, is after 28 weeks. The risk of stillbirth is up at least 2 times as that of women who don't use drugs. Miscarriage is defined as delivery before 20 weeks gestation. The risk of miscarriage is strongly linked to cocaine and methamphetamine use. Low birth weight babies are those babies that weigh less than 5 pounds and 8 ounces and have smaller heads than normal weight ones. These babies have many health problems that include increased risk of infections, feeding difficulties, and long-term developmental issues. Congenital disabilities with heart defects and a neonatal abstinence syndrome, which is a baby in withdrawal. And keep in mind that regardless of the drug, the neonatal abstinence syndrome or withdrawal symptoms in a baby looks exactly the same. These babies can have learning difficulties. More have ADHD, which is attention deficit hyperactivity disorder. They have problems speaking and understanding what is said. 28 states have mandatory drug testing of pregnant women and drug testing of newborns. In those states, it is believed that drug use during pregnancy is child abuse and must be reported to the state's child protection agencies. Because of these laws, many pregnant women do not seek treatment for their substance use for fear of forced drug treatment, going to jail, and losing the right to be a parent when the baby is born. Women who use drugs while pregnant need help and care, not to be blamed or treated like criminals. Years ago, when I was the medical director at the Women's Treatment Center in Chicago, Illinois, I admitted a pregnant woman, and she told me that she had a headache, and she told me what drug she wanted for her headache, but that drug was contraindicated or could cause birth defects. So I told her, as kindly as I could, that drug can harm your baby. And this woman looked me in my eyes and she said, F this baby. You act like you care more about this blankety-blank baby than you do me. And I have an effing headache and I want such and such for my headache relief. And I had to stop because she was right. I was more concerned with this unborn baby than this woman that was sitting in front of me. And I apologized to her, and I started treating her more compassionately and putting her first because, after all, she was my patient and not this unborn baby. These pregnant women need compassion. They need to be seen as human beings first and not just as a carrier of an unborn baby. So please keep that in mind when talking to and or working with women with a substance use disorder and are pregnant. Remember, you are not alone. And for assistance, call the National Helpline 1-800-662-HELP. Type in your computer search engine, findtreatment.gov. If you want to hear more real talk about physical, mental, social, and legal complications associated with substance use disorders, join me on Ask Dr. Dora podcast. Send your got to know the answer to inquiries to questions at AskDrDora.com. You can encourage me to continue educating you on addiction medicine topics by liking and subscribing to Ask Dr. Dora podcast on all social media platforms. Thank you, and I'll see you next time.